Good morning or good afternoon to everyone. I'd like to welcome you all to today's panel discussion, Sustainability and Health Systems. My name is Nicole Grubner. I'm a partner with Finn Partners, which is a global full-service communications agency. I'm also the head of our environmental innovation group and have been working with innovators and stakeholders in both health and climate tech for almost a decade. So I'm very excited to kick off today's conversation. I want to thank Levi Shapiro and mHealth Israel for bringing this incredible group together today. For those of you who don't know, mHealth Israel is a nonprofit organization comprised of entrepreneurs, investors, developers, and healthcare professionals applying technology, mobile, and healthcare expertise towards connected health innovation. So Levi, thank you so much. Before I introduce our panelists, I just want to set the stage for the conversation. Today we're talking about climate change in healthcare. We've all seen the effects of climate change impacting the world: extreme weather events, food insecurity, water scarcity, extreme heat, and the list goes on. Of course, these are all going to take and are taking a toll on human health, from increased respiratory illnesses to increased waterborne diseases to increased rates of anxiety around the impacts of climate change. And ultimately, the planet doesn't need us, we need the planet. So solving this thing is in all of our interests. So on one hand, health systems have to be ready to address the emerging health challenges that are going to come out of these new realities. And at the same time, health systems have to take a close look in the mirror at their own footprint. The global healthcare industry is responsible for 2 gigatons of carbon dioxide each year, which amounts to 4.4% of net emissions worldwide. Hospitals generate about 5 million tons of medical waste annually, from everyday trash, such as medical packaging and food, to regulated medical waste, surgical gowns, gloves, syringes, IV bags. If the healthcare sector were a country, it would be the world's 5th largest contributor to greenhouse gases, following China, the U.S., India, and Russia. So that's not a place of pride at this point for the health system. So we have our work cut out for us, and fortunately today's panelists are working towards solutions. So let's introduce our speakers. First, we have Philip Guster. Philip is Director of System Sustainability at Henry Ford Health System. He comes from DTE Energy, which in 2021 partnered with Henry Ford to help the health system reduce its greenhouse gas emissions through DTE's voluntary renewable energy program, with the purchase of wind and solar in greater quantities over the years. Henry Ford is an institution and a system that has prioritized sustainability and made some serious commitments, which it's working towards: reducing scope 1 and 2 emissions by 50% by 2030, achieving net zero by 2040, reducing landfill waste by 50% by 2030, and increasing annual investment in green and healthy infrastructure, among many other commitments. So Philip, thank you for joining us today. Next up, we have Dr. Reid Omary, the Carol D. and Henry P. Professor in the Department of Radiology at Vanderbilt University Medical Center, with over 25 years as a practicing interventional radiologist. Though he recently stepped down from his position as chair of radiology after about a decade, he's career pivoting towards sustainable healthcare to motivate U.S. healthcare systems to decarbonize their operations and adopt sustainable practices. I recently heard Reid speak at the Boston Globe Sustainability Week on a panel called Embracing Sustainability in Healthcare, and he has also started a blog called The Green Leap, focused on sustainable healthcare, so I encourage everyone to check that out. Reid, when you spoke on that panel, you said we have to treat the planet as our biggest patient. So I hope we'll get to hear you speak about that today. Welcome.
Thank you, Nicole. It's great to be here.
Next up, we have Elizabeth Morris, chair at the Department of Radiology at UC Davis Health. That's another institution with a history of commitment to sustainability. Liz approaches sustainability through a more academic lens, exploring and thinking holistically about planetary health for our healthcare within our healthcare system. As I said, UC Davis is another health system that has really stepped forward as a leader in sustainability. At the end of last year, UC Davis was awarded the Gold Climate Resilience Award and the Silver Climate Leadership Award from Healthcare Without Harm's Healthcare Climate Challenge. which is a global awards program recognizing healthcare organizations for their sustainability and environmental protection actions. UC Davis also joined the UN's Race to Zero campaign that rallies institutions to cut emissions in half by 2030 and become net zero by 2050. Liz, thank you so much for joining us.
Thanks for having me, Nicole.
And finally, we are crossing over the pond to the Netherlands, and I'm really pleased to introduce you to Bert Hartog. Bert is the Interim VP of Sustainability and Transformation at the Digital Medicine Society, a professional society for the digital medicine community that focuses on driving scientific progress and broad acceptance of digital medicine to enhance public health. Bert is an expert on clinical research and digital health and has had management positions with Johnson & Johnson and Eli Lilly. I know Bert will also be speaking next week at Fierce Biotech's Sustainable Innovation in Clinical Devices, a pioneering guide for future-ready trials panel webinar. So if you like what he says today, then I encourage you to register for that event as well. Thank you, Bert, for joining us.
Thank you, Nicole. Glad to be here. Looking forward to our dialogue.
So I want to mention that there is a chat function, and I'll be checking that periodically for audience questions, and we'll try and squeeze those in. As everyone can see, we have a really amazing group here, and we're fortunate to have representation from both the US and EU. In addition to representation from both the clinical side of healthcare and from the sort of systems operational side. So we'll be able to get a really broad range of perspectives. So I want to start with a very simple question. What made you decide to turn your focus towards sustainability in healthcare? And what do you see as the greatest challenges facing healthcare when it comes to sustainability? So Bert, I'd like to start with you, and then we'll go Liz, Philip, Reed. So Bert, why don't you kick us off?
Thank you. Very happy to start. So in the introduction, Nicole explained, I've spent my career in clinical research, looking at clinical trials and looking at ways to make clinical trials not only scientifically very robust, but also very attractive for participants to take part in. And part of that is convenience for the participants. And that's where digital health technologies can make a huge, big difference. Allowing new science to be introduced into trials with measurements that before were not possible, but measurements that patients really care about. Measuring sleep, quantifying in an objective way people's activity during the day, people's whereabouts during the day, how do they behave, the details of their movement patterns and so on, all very relevant and opening up a new era for science in the healthcare domain. The light bulb moment for me was when I realized that many of these digital health solutions come from digital health devices that are produced for single use. And when you look at the numbers and you see at the beginning of the 2020s, 100 million devices newly issued into the global market, I realized that that is a mountain of electronic waste that nobody has given much thought to. When I started testing this hypothesis with stakeholders in hospitals, other pharma, academia, everybody acknowledged that this is an underserved part of the digital health transition that we see happen. And it's something that warrants attention. But that really got me going. The challenge is changing practice. Healthcare is notorious for sticking to established ways of working. And there's a good reason to do so, because that is a more or less guaranteed way to get to predictable outcomes. So changing practices is very, very difficult. And that's where we have to work together. And you see some of what we need today reflected with healthcare systems, clinical specialists, and others from the ecosystem collaborating on making the change happen. But that's what got me going. I think together we can overcome the challenge.
Thank you so much, Bert. Liz.
Well, I recently, well, not recently, but 3 years ago, moved from Manhattan, New York, to take the job at UC Davis. And I found myself in an environment, as you said in the introduction, that was very geared towards sustainability. I think, UC Davis is #1 in the country for sustainability. You can actually major in many different majors for design, for toxicology, agriculture, sustainable practices. So because of that environment, I started looking around at our department, and it's great to be at a place that walks the walk and doesn't just talk the talk. And I got a couple of very interested and passionate people. There's a lot of grassroots movement at UC Davis. And so we are focusing a lot on education and research, as you said. We're applying for grants to study this so that we actually have the same language that we're talking about, so we can actually measure. I am chair of radiology, which is one of the greatest contributors to the greenhouse gases emissions for the planet. We need to be able to figure out how do we actually make our machines work for us and make it a lot more sustainable. I'm also interested in AI research, and as Bert pointed out, it's a double-edged sword. I mean, it can help us in many ways in sustainability, but also these storage systems can cost us quite a bit in energy consumption. So that's how I became, and then I had Reed out as a visiting professor, as he's become the spokesperson really for clinicians for sustainability, and that just catalyzed everything. So I think it's our number one problem facing us, to be honest. I think we have to get this right. We have to really start talking about it, communicating, trying to work together. For us, it's really important to work with industry, with our industry partners to get it right. What I think the biggest challenge, I think Bert said it, it's just doctors are conservative. And, there's, when you have new technology that comes along, it's often 16, 20 years before you actually get any kind of traction for change. We cannot wait that long. This is something that is really, imminent, and we have to really be nimble and fast. I have a huge amount of hope for this, in the fact that our younger generation, the Gen X, and the millennials are and the Gen Zs are really passionate about this. So I feel like if we harness this, we can really get some traction going and get some change.
Yeah, I really both Bert and Liz, what you said, we're asking a lot of our health systems to make this change, because it's not just about improving clinical outcomes, but it's improving planetary outcomes, and that's a lot to ask. Reed, can you give us your perspective here, and what made you make this big change?
Sure, Nicole. And I think, like many people, going back, I look at my life as kind of pre and post pandemic. And I think before the pandemic, I was probably like many of the folks here today. I would tend to think about being green in my personal life, but not really thinking about as a physician how to bring it to work. It was like I was living two separate lives, and it took the pandemic to like inject me with this realization that as a physician, being in the field of healthcare, that we had not just an opportunity, we had a responsibility to our societies to step out of the confines of our medical centers and try and benefit our communities and frankly all of our nations. We saw when in the pandemic that what happened in one part of the world could affect another. That was absolutely disconnected. And so I had this aha moment during lockdown that I wanted to do everything that I could, not only to benefit the communities during the pandemic, but to take on the even larger and more complicated and greatest challenge that we've ever faced, which is climate change. And so I started reading up on it, and the more I read up on it, the more I realized it was real. Not just climate change, but the fact that we in medicine needed to tackle this because the effects of climate change were like COVID. They were affecting the people who could least tolerate it. So that's what led me to want to pivot and fundamentally think about my career as what's the best, what's the most impact that I can generate. And when we think about medicine and healthcare, it's generally from the perspective of the patients that we serve. When we think about climate care as fundamentally patient care, we now suddenly have 8 billion patients that we can try to benefit, and then all the future generations. So that's what it was for me, Nicole.
Yeah, and you're so right in terms of COVID, at that time, flights weren't going as much. We saw a drop in emissions, more telehealth, less emissions related to transportation, getting to and from hospitals, and then we kind of went back. So, Philip, let's have your answer, and if you want to speak to that a little bit, that would be great too.
Yeah, well, I don't know what's left to say. Going last, I don't know how that is. Personally, let me just start by saying, so the participants kind of get to know me a little bit, as Nicole did a great job introducing all of us. But I'm looked at myself midway through my career. I was working for the largest utility in the state of Michigan, one of the largest utilities in the country. And I started my career in manufacturing, both automotive and food manufacturing. And then I went to utilities for the last 13 years. I am new to healthcare. I will be honest, just so the participants know and fully transparent, I never thought I would work in healthcare or in a hospital. But my background is engineering and energy efficiency, and systems are systems, and healthcare has large systems behind the walls to our patients or our customers. And so I look at myself as an expert in building operations and systems. But when I looked at my career at DTE Energy, awesome, great company, if anyone's here interested to work for utilities, but there is so much more. And I think all of us panelists have said this, that I wanted to learn and grow as I'm midway through my career. So that's me, why I decided to focus on sustainability. But in my short 6 months here at Henry Ford Health, we as a safety net hospital recognize the importance that we play. If anybody followed, we were just talking about this before this started, if you follow anything that's going on in the city of Detroit, and it's revitalization. And we recognize our presence here as an anchor network, as a safety net hospital, right? Our hospital has been here for over 100 years. And the picture behind me, I think if I move just a little bit, in about 5 to 6 years will be a new 21-story tower that will anchor Midtown of Detroit. It is going to change the skyline here. And so we recognize that. Detroit also, you heard the statistics about how much emissions healthcare globally contributes, but our population here of Detroit is one of the unhealthiest as well as one of the poorest. So we need to do something. And our patients, our customers are expecting Henry Ford and expecting healthcare to be different. And so we want to make that change. And I'm so glad to join the Henry Ford team. We have a culture of inclusion. And I think somebody else said it too. We are not going to do this alone. And I think we'll get kind of to some of that in a little bit, but our success will be through our partners.
Yeah. Yeah, that resonates a lot. And I think it's like even if you don't work directly in sustainability or health, we all have to work in sustainability and health, no matter what we're doing. So thank you for that, Philip. Liz, I want to go to you. And we alluded to this in some of the responses now, but clinicians have a lot on their mind, like their patients, for example, and improving outcomes and integrating new technologies and dealing with burnout. And the list goes on of all the considerations that clinicians have going on in their minds, staying up to date on the latest research. So how does sustainability even have space in your mind as a clinician you know, as you're kind of going about your day?
Yeah, well, I think it has to not be an additional thing that you have to think about. It has to be something that just sort of is something that's pervasive and in all aspects. And actually sustainability, it can make your day probably as a clinician better in many ways. And if you think about it in those terms, for example, you know, improvements in efficiencies, you know, in my very small area, it would be making sure the protocols for the patients are better and shorter. We can definitely do that. And also improving throughput, improving situations where people are working. You know, even just small things that you can think about, like, for example, we just installed, you know, motion detector lights or things like that. I mean, these kind of small things can be additive over the entire system and the entire country. So, I mean, there can be very small at least initiatives or processes that can actually make it a better environment for people to work in and better for patients as well.
It's great to hear about that kind of synergy. Reed, you're nodding your head a lot, so I would love to hear your thoughts here as well.
Yeah, I think Dr. Morris totally hit on it, and we don't want to think about this as separate. We already have too many things on our plates, and frankly, there's a massive staffing crisis in healthcare right now. Not only not enough staff, but a burnt out staff, where 2/3 of nurses are burnt out, and roughly half of physicians, depending on specialty, 1/4 of physicians in the United States are clinically depressed. If I gave you those figures, you know, just think about if one of our kids were to go into a profession. They didn't tell us what the profession were, but they said that there's a 2 in 3 chance we're going to be burnt out, and a 1 in 4 chance we're going to be clinically depressed. We go, you know, you might want to I don't know what the profession is, but you might want to do something better. Or we would think it's something like like the arts, like that there isn't an ROI, and that's why they're pressed. So we have the opportunity now really to bolster everything we're doing with healthcare with a shift in this mindset. And I want to amplify what Dr. Morris said when she talked about the benefit to patients, and also to what Bert said. When we care for the planet, we're actually also caring for our patients. Planet-centered care is patient-centered care. If patients don't have to travel in to find parking, and all, like, where do I park? And the spots are so skinny. Like, it's just so much easier. So when we can move to telehealth, that's an example where we hadn't really considered it before as a sustainable intervention, but it's a massive sustainable intervention. And we can start measuring the carbon cost journeys for all of our care algorithms. That's an incredible opportunity for research. It's an incredible opportunity for innovation. When I say innovation, an incredible opportunity also for entrepreneurs to come in and think about how we can better our healthcare by embedding sustainable practices that save money, that bolster the sense of meaning in our workforce, and benefit our patients.
That's great. And I think what you're speaking to, it kind of leads me right into the next question, because when I'm thinking about sustainable transformation, my natural inclination is going operational, of course, systems level, energy use, those, the lights with sensors, making sure you're not using plastic, single-use plastics in the cafeteria, et cetera. I just brought like 3 bowls from IKEA to work that anyone can use. I'm like, I work in sustainability. I should obviously have bowls that I can use at work that aren't plastic. So Philip, I wonder if you can address this, because this is really what you're working on at Henry Ford. How do you look at introducing sustainability programs from that systems level, and how can this support or augment the ways that clinicians are working?
Yeah. Well, this is my first time working with clinicians, but it's as I said before, maybe it's a broken record, but we are all working. Each industry is relatively small in its segment, but we're all working to do some type of continuous improvement. And when I've talked to doctors and nurses so far in my small time here, we're all doing the right thing. And I think, Reed, if I heard you correctly say, it's the data to show what I have presented to my leadership. I think what we're missing working with our clinicians is the visibility of the data. We're all doing the right thing, but it's articulating that story to keep people going. He talked about burnout, right? Because they have so much other on their plate, and their first priority is the safety of their patients and the safety of our workforce and others around them. And so to ask them to do something like this, but we all naturally want to do the right thing. And so from a system perspective, I'm working really hard with different groups, IT, supply chain, environmental services, everybody, to somehow, it's huge. We've been working on it. This is not a short test. We've actually been working on our energy data for 3 years to make sure that it's accurate. So I don't want to say this, so there is no greenwashing. So we're as accurate as possible when we report our emissions. And so this is a long journey. It started, almost 3 years before I got here, just on what we purchase from electricity, natural gas, and water. So my goal over the next 18 months is I'm claiming it as the visibility of sustainability. And that's how I plan to engage the presidents of our hospitals and their workforce, including our doctors and our nurses.
That makes a lot of sense, because if you can't measure it, you can't intervene, essentially, right? We know that from a scientific perspective, and it makes perfect sense here with sustainability.
Yeah, and just small notes, when I got here, we signed up for some pledges here at Henry Ford, and a lot of other healthcare networks have too. But when you do that, one thing that we had good data on, and that I can speak statistically on, is anesthetic gases. And that is one of our goals. And Suprane, let me hold on. So, yeah, desflurane or Suprane, right? Very toxic to the environment. From 2019 to 2022 now, 23 data we have, but it's not here on my chart. We've reduced its usage from 25% down to 1%. Wow,
really impressive.
Yeah, so I mean, I can talk to that, and that's the data that I'm talking about. But it goes down to what Nicole said. I can't remember who touched on, the single-use objects, from electronics to silverware, in our hospitals, to whatever sharps and everything else that's out there. Yeah, we need to keep working on that. But having that data, like I just said, that I'm looking at this, simple spreadsheet in 4 years, reducing it to almost where it's non-existent in our system.
Yeah, and I imagine that there are things that are the short-term, sort of low-hanging fruit, easy wins, like changing out single-use plastics, and then you're kind of planning mid and long-term as well, as new solutions are kind of coming about. So that's great. I want to move to the next part of our conversation, which is really crucial to make sure that we keep making progress, and that is policy and regulation. I know a lot of people in our audience come from innovation and entrepreneurship, but policy and regulation are what create the environment that allow these technologies and innovations to have their intended impact. So it's a really important part of the conversation. Bert, I'd really like to start with you on this. How is policy either helping or hindering the advancement of sustainability initiatives in health systems? And who's learning from who here? Is it the U.S. learning from the EU, or is it the EU learning from the U.S., or is it a little bit of both? So can you speak to that a little bit?
Yeah, happy to. And the short answer is US is learning from Europe, Europe is learning from US, and we're both looking at the rest of the world for further inspiration. There's fantastic things happening in many different places. The difficulty is scale. And we really need to transition from point solutions, proof of concepts, pilots, individual clinics, individual hospitals, individual networks doing their own thing, which is good and should continue. But we need to move up to the network level, where we start addressing issues at state level, at country level, at region level, to really have the impact we're looking for. Every little helps, but we need to start transitioning from innovation into scaling. That is important, and that's where policy can make a difference. One example in Europe, this light bulb moment I talked about, the electronic waste resulting from digital health devices, that was the beginning of a consortium with academics, with hospitals, with business school, with pharma, with medtech, with startups, and funded by the European Commission to really start working on how do we design these technologies for recycling, be it reuse, be it repurpose, be it any of the R's. How do we look at incentives for people to return these devices after use? There's a behavioral science component here we might be playing into. And then at the downstream, on the downstream side, how do we work with these waste managing companies so they are equipped to handle this medical waste? They don't incinerate it, but they actually allow for recycling, recovering the rare earth materials, the precious metals, and all of that when a product has reached end of life. The European Commission, and some of the audience may be aware, a few years ago, there was a Green Deal approach, a big document describing how different industry sectors and how different groups of stakeholders could really play into the environmental requirements. That same team awarded a significant amount of funding to do a 4-year program called Digital Health in the Circular Economy, DICE for short, to really come up with policy recommendations. What should governments do? What should policymakers do? What should individual stakeholders do to really address some of these issues? Is it about criteria for market access? A new product without an environmental sustainability component is not going to be granted access, more like the stick. Or is it more about incentives where you get exclusivity when you do meet some of these requirements? Or is it both? So we're working on this. In coming years, the detail will come out. But already now, at policy level, getting people to think about shifting from innovation, proof of concept into scale, that is going to help us get into the next phase of addressing these sustainability and climate issues.
Yeah, and when you think about resources and resource efficiency with the electronic waste or otherwise, how much energy, how many resources went into making that thing, and then to just let it go to waste is like, wow, what a waste. And we sort of can't do that anymore. Liz, can you give us your thoughts from the U.S. perspective on this policy conversation?
Sure. I mean, actually, just following up what you just said, in my area in radiology, we have very big machines, as you know, MRI machines, CT machines. So there's a lot of effort or thought put around just refurbishing, those machines so that we're not actually even recycling them, making the machines better. But this requires, as Bert was saying, a huge amount of effort and connecting people who normally weren't really connected all that well in the past, and making new regulations and guidelines. And I think in the medical space, I think societies can be very strong in this area and trying to put out suggested guidelines for example, for MR machines. And there's the Energy Star program here in the U.S. as well that could impact vendor regulations and guidelines and things like that. So I think those are sort of the relationships that we need to really think about building. And they're not normally I would never have talked to an Energy Star person until several years ago. But this is critical, because as you said earlier, we need to be speaking the same language. We need to be able to get these kind of guidelines so that they're not only just used in the US, but also in Europe and the rest of the world as well. As you know, these are the guidelines on energy usage for certain kinds of, at least in my area, machines. And that this is, you know, leading to best practice. As far as the US, we do look to Europe. I think they're ahead. I definitely think they're ahead, Bert. You know, there's different areas where they have, you know, flagged, for example, in MR, we use gadolinium a lot, which is a contrast agent that gets excreted into the water. And so they're, you know, in Europe, they're very concerned about the rising levels of gadolinium. You know, that was something that we weren't even measuring here in the US, but now that, you know, that Europe has sort of brought that forward, we're now thinking about that kind of thing. So I think we can learn a lot. They are usually ahead of us on environmental, you know, policies and ideas. So I tip my hats off to the Europeans.
Yeah, that's for sure. So what I think is so important here with the regulatory conversation is that, like we kind of talked about earlier, is the health system doesn't like to change. So there is, you know, this stick element of, well, you're going to have to get to this milestone of renewables, and you're going to have to get to this level of circularity, I think is so important. But that brings us to our next question. Because it has to make business sense ultimately. I mean, certainly in the U.S. system, which operates, you know, more like a business versus the EU. But where is the opportunity? Reed, when we spoke last week, you told me about this conversation with the VC colleague in Israel who was asked if his company was a green business, and he said, if by green you mean making money, then yes. So solutions and changes that are coming in have to have this balance of people, planet, and profit. So my next question here is, what is the role of innovation in accelerating the sustainability transformation, and what's the business opportunity in it? Reed.
Yeah, thank you, Nicole. And I want to emphasize that we have to use every single lever that we have, so we can scale change. And even the words we use can be charged with a sort of an economic, or I'll just say private versus public good perspective. So an example would be, you know, policy is what we do to others. You know, we want others to. Regulation is what's inflicted on us. You know, that's like, you know, and so even it's like in those words in the United States, which you know, has much more of a, you know, private feel than what I'll say is the public good and commons approach of Europe and many indigenous cultures. We have this lever, and that lever fundamentally is an economic lever. And we have a lot of money that we are leaving on the table when we don't think about sustainability. And when we're doing sustainability right, it is saving, it's reducing waste. Anytime we reduce waste, we should be saving money, and that those funds can be used to inject into new areas that also can grow our economies. And so I think about what sustainability has an opportunity for entrepreneurs to come in and use the finance lens, which may actually lead to more quicker adoption than what has been the standard lens of, if you will, you know, climate change folks have often come from, oh, we have to do this for the planet. If people aren't wired for that, we have to get the same outcome. We just use a different pitch. It's just saying, like, it's just, you know, this is pitching 101, meet the needs of the audience. And so at the same time, what entrepreneurs can teach us in the world of planetary health is how to scale. Entrepreneurs, like, how do we scale? How do we do this fast? And how do we grow? And so there's a lot that we can learn by just listening. What are the different techniques we can use so we can do that hockey stick in terms of trying to grow all of these sustainability initiatives?
Yeah, that's right on the money, should we say? um, Philip, I know Henry Ford has been in the sustainability game for a while, and this is really where you're working. Can you talk a little bit about how Henry Ford is taking innovation and technology to make some of these changes?
Yeah. Right now, as we're building this new campus, it is building our new hospital with sustainability first. And I like what Reed said. I've always used energy efficiency and these types of projects and continuous improvement as a pay it forward program, right? So when you're selling programs to executives or to clients, you know, it's the money that we save now. Can we pay it forward to continue more innovation, more projects? But getting back to what Henry Ford is doing in downtown, building our new campus with sustainability as a priority, analyzing, it has to make good business sense. Unfortunately, some things are just very costly right now. I didn't get to say this in my opening comment to why we decided, or I decided, sustainability in healthcare. But a challenge, even though the United States government is funding billions of dollars in incentives and tax credits and things like that, but capital is a huge challenge, and access to capital, especially, you know, you mentioned it, you know, we are for-profit, non-for-profit organizations around the world. Access to those funds and capital funds is a challenge. So with that being said, though, also with existing projects that Henry Ford is doing, is I'm implementing energy efficiency and sustainability in the contracting phase, right? When we go out to RFPs and we're seeking our partners, I mentioned in the opening as well, we can't do this alone. It takes all of us. We are a large organization, but we contract millions of dollars with other organizations, and it's putting those contractors and vendors and holding them accountable for sustainability up front. Sustainability, energy efficiency, all those buzzwords, you know, it's typically an afterthought. And we need to change that thinking to becoming part of our RFPs so they can bid that, and then holding them accountable to that, or at least give us the option to choose something that would be more sustainable or more energy efficient, right? We understand there's incremental costs to sustainability, but at least let us choose what it is, or help us find those, you know, put our vendors, holding them accountable for some innovation and giving us the opportunity to select and make the right choice.
Yeah, and that's really kind of getting into like scope 3 and being accountable for, you know, the footprint of your vendors, and it's such an important point. Looking at, you know, even the materials that you're using to build, you know, that facility. What are your walls and floors made of, for instance?
That's correct. Yeah.
So Bert, you're looking at it more, I think, you know, clinical trials, medical devices. Can you talk a little bit about innovation happening in that space to make those things more sustainable?
Yeah, absolutely. And clinical research really is the prelude to clinical care. So anything happening in clinical research is a potential opportunity for scaling when successful in clinical care. Not all research is successful. Some products never make it to market, but the ones that do, when looked at for sustainability, allow for exponential application of the benefits, exponential realization of the benefits in clinical care. Some examples, and we're really starting at square one here. We have started in partnership with the Sustainable Healthcare Coalition in the UK and in partnership with the Pistoia Alliance organization, to start quantifying the environmental impact of clinical trials. What's the carbon footprint equivalent of a clinical trial in a very modular concept? So when you have those numbers, you've got your baseline, you can do benchmark, you can start pointing out what good looks like, you can see what's higher, what's lower, what are the drivers, and to Reed's point, what are the levers you want to play with? Can you do something different? Can you touch the science in an adverse way? Absolutely not. Can you touch patient safety? Absolutely not. But can you touch logistics for utilities? Can you touch packaging? Can you touch some of these other components? Absolutely you can. When you look at the healthcare system, and I think in the US the term is hospital at home, which is really a way to bring care to people in their local environment. Remote monitoring is what we see as part of hospital at home in clinical trials. There is already published material that a hospital assessment done in a home setting has a 20% reduction in carbon footprint. 20%. Wow. So multiply that by the millions of opportunities, that's impactful. So when we start thinking about changing the way care is done, you can have real impact at a systems level. You can make that the norm. Maybe not impose it on people, but offer it first. We're going to do this assessment. Why not choose for the remote option? We're going to do this clinical trial. Why not choose for the lowest environmental impact? That starts with the data. And what I'm finding is more and more companies, first individuals, then companies, are becoming interested in taking this approach. But you have to very carefully explain, it's not going to touch the science, it's not going to touch safety, that needs to be ring-fenced, no question about it. But beyond, there's so much that can be done, and we're beginning to see it happen with very robust data to show the actual impact, and then you can go into this exponential realization with scaling. And there's a lot positive coming out of research into the care environment.
And it's really amazing that you're able to hit, improved care, improved access, and improved sustainability all through, this one approach. So it's so multifaceted in terms of the benefits. Philip, you spoke a little bit before on the issue of climate finance, which really is who's going to pay for all these things. And it's great to talk about all the innovations and telehealth and new medical devices and electric vehicles even, if we're talking about transportation in the healthcare system. So the obvious next question is, how do we make sure that all of these efforts and technologies are accessible and equitable to all communities and to marginalized populations and to developing countries? How do we address these disparities? So Liz, if you can talk to us about that, I'd appreciate to hear your perspective.
Yeah, I think that's a huge opportunity. And I think, it's only recently that, healthcare systems have really started to address inequities, systemic racist policies and all of these kind of things. I think that has to be factored in completely, that we don't leave behind marginalized communities. And I think, according to what everyone has been talking about, the scalability up to the global level, particularly for lower middle income countries and healthcare in those environments. I mean, we have huge opportunities, I think, to help, as Reed was saying, planetary health. So, for example, just, in our small area, we're investing in vans to go out to the, to the place where people are living. We have a huge telehealth population kind of check-in with primary care. We have, we have a lot of clinics out in rural areas. And so those are the kind of things that I think we can help, so that as in the future that we can actually access, so that people can have access to the healthcare system, which is a huge problem currently. Yeah, first and foremost, I don't have any great solutions as yet, but I think shared best practices is where we need to go. Yeah.
Philip, I think we kind of talked about this a little bit yesterday, but if you can weigh in here as well, that would be great.
Yeah, I don't know. Can I say that?
You
Can I
can.
be honest and say I really don't know? And I don't know how that is, but I do know from an engineering and architecture standpoint, for this campus, as I mentioned before, our new hospital, I jokingly said, because I have to, when I talked to my parents and said, oh, I'm heading to a hospital, they're like, are you okay? No, I work there now, right? But the with this new hospital, I never thought that we would be designing mobility for bicycles. I hope no one has to ride a bike to the hospital if they're injured, but that's not exactly, I'm kind of joking here, but that's not what we're talking about. But this mobility, this alternative transportation, designing those different streams other than just the vehicle or the ambulance, right? There is an area for, yes, electric vehicle arrival, which is in the future huge in Detroit, obviously, given, our manufacturing presence. But it's the Ubers, the Lyfts, the community transportation. How do we get those people here and make sure that it's easy for them? Because right now, our existing sites doesn't have that area for mobility or alternative transportation. So I will just say again, Henry Ford, our vision, our commitment to design sustainability in these different types of mobility and access to healthcare. I do not know, I can't talk about our telehealth programs, but I do know we're designing our new facility with different access points for our customers and our patients.
Bert, you came off of mute, and I'm just wondering if it's because you want to say something here.
Yeah, I just want to throw in an additional perspective, and that is where sustainability is a byproduct of a changed practice. And going back to the hospital at home example, for equity, that will allow people to receive care that today are not in a position to receive care. Maybe because of logistics and transportation, maybe because of work arrangement where they can't take time off, maybe because of something as mundane as living 5 hours away from the nearest hospital. So equity is also reaching those parts of the population that today do not have the routine access to care. And with hospital at home, with remote monitoring, with telehealth in general, the byproduct is sustainability. So that's a different way of kind of flipping the narrative, where we don't have to be too religious about sustainability first. Sustainability second, as a byproduct embedded in a different practice, is as welcome.
Yeah, and these things that we have are so powerful, right, for making care accessible, because certainly in a country like the US or the Netherlands, like, who doesn't have one of these? And you have a single parent at home who can't take time off work to take their kid to the doctor, and you can make it accessible with a cell phone. I mean, that's an incredible step in the right direction for access.
Hey,
We just
Nicole,
have yeah,
can I just amplify what Bert said there, and actually turn equity and addressing disparities into the opportunity of this century. We have all these disparities right now within nations, across nations, different continents, because of these systems that have been in place for decades to centuries. With this green transition that is going to happen, not as fast as we want, this actually presents us the first real opportunity to try and redesign our systems that also can be redesigned through an equity lens. And so let's consider these as linked, two strands of DNA. We can address the planet's health and address equity at the same time. Often, as Bert said, with solutions that may have sustainability as a byproduct or may have equity as a byproduct. Either way, it's a win.
It's that great Venn diagram, right, of where those two things coincide. So we have just a couple minutes left, so I want each of you to take 1 minute to respond to this last question of what gives you hope. So Reed, why don't you start, and then we'll do a little round robin.
You know, what gives me hope is knowing that we have younger generations. We look at the Gen Zs, 25% of college graduates, even in the United States, consider climate change the #1 issue facing humanity. So we're going to have a wealth of individuals who want to enter the workforce with this mindset. And we can get to the point where Philip, working for a utility company in his previous life, thinks about himself as being in healthcare. And then when people who are in healthcare think that they're also doing climate care, because we're all interconnected. That's what gives me hope.
Incredible. Bert?
Yeah, thank you. Building on what we just said, what gives me hope is that there's boundaries are blurring. Traditional boundaries are disappearing. The world is very much connected, and we can see those little spots, those little glimmers of hope where somebody is doing something different with some different outcome. Those can be amplified. 100 years ago, nobody would know what would happen somewhere else. Now we know. We can see instantly. And when we leverage all that knowledge, which is where these boundaries are blurring, because people are more willing to learn from others than ever before, then we can collectively go up and really start addressing at the system level, scaling everything that works and addressing collectively where we need additional solutions. So I think that is a change in culture and mindset that gives me tremendous hope.
Great. Philip?
Yeah, thank you, Reed, for that. I appreciate that. I will just say that we are not alone, and we are continuing to try to listen and learn from everyone in this space. But speaking directly from a Henry Ford perspective, is that we have top level executive support, CEO impact, that have the ability and the authority to impact and push change down from the top level down. 20 years ago, when I started my career in manufacturing and we were trying to do energy efficiency, production was king, not energy efficiency, not sustainability. It was production. And it doesn't matter if it was cars or meat or whatever I was in, but it was all about production. But now executives have this at the top of their mind, and they are pushing it from the top down. And here at Henry Ford Health, we take that very seriously.
Great. And finally, Liz, if you can give us
Sure.
your point of hope here.
Quickly, I'll say leadership, super important. And I'm sensing that a lot of leaders are seeing that, and that's in industry as well as in academic medical centers and hospitals throughout the country. You know, it's a best business practice now. I mean, every single business that I talk to in the manufacturing space you know, it's on their webpage. It's really important. So I think, you know, by having a grassroots, you know, build up of that's also important, but so they know that there's a market out there for this. And as you said, it comes down to dollars, and
Yep.
That's what it is. But I think that the market exists.
Yeah, what's great to hear is that it's coming from the top down, it's coming from the bottom up, it's coming from both sides, and all around. So even though there can be this doom and gloom approach when we're talking about climate change and, oh my gosh, what are we going to do? But as we've heard today, there are solutions, and there are people at the highest of levels thinking about this and making these changes. And that gives me a lot of hope. Thank you all for joining, for giving us your time today. We really appreciate it. And it's been really inspiring to hear from all of you about what you're doing, what your institutions are doing. And I encourage everyone who's on this call to follow these people on their platforms, on LinkedIn, on X, to see what they're doing and get their updates for more inspiration and to see what progress is being made. Thank you.